My name is Emily. Every few months, my mom donates blood here at the donation center. Today, I asked if I could come along. I wanted to learn more about how people donate blood. People here at the blood center told me that of all the people who can donate, only 4 out of 100 do, and that means there isn't enough blood for people who need it for things like surgery. Since there's not enough blood, scientists have worked to come up with new ways for donating. But before they explained all about how to donate, I had to learn more about blood and its different parts, like red blood cells, plasma, and platelets.
When a donor comes in, there's different types of donations that they can give. Whole blood, red cells, plasma, and platelets. The red blood cells gives us nutrients for our body to live. They're usually given when somebody has blood loss. Plasma is the clear fluid that helps the cells move in our body. Plasma is usually given to burn victims. Platelets is the clotting factor. It helps us stop bleeding, and those are given to patients that have cancer and leukemia.
They told me that someone who was in a bad accident could use as much as 100 units of blood components in just a few hours. Brad Turpin is a police officer who was in a motorcycle accident.
I was on my way to work, cool, crisp morning, coming on Spencer westbound, and had an accident with an 18-wheeler. Unfortunately, I was on a police motorcycle, so I lost out to that. I know that I was told that when I arrived at the hospital, I was on empty as far as my blood supply went. I had torn such a hole in my leg, and I believe the blood they were putting in me was going out that hole just as fast as they could put it in. How much blood I got into operating room, I don't know, but I know they pretty much had to fill me up with it. So I'm glad it was there to help me out. Those people who do give are just near heroes as far as I'm concerned. And it's not words that you can say that to tell somebody how much you appreciate the fact that they take time to do that.
For cancer patients, platelets can be very important to save a life.
It was kind of a long process before we found out exactly what was wrong with my daughter. She had been exhibiting symptoms for several months. She had just started first grade, and all was well in the world, and she was a happy, bouncing, very active child, doing all the normal activities a 7-year-old does. But she started to have fevers. I couldn't figure out why. And we went back and forth to the doctor, and she was diagnosed with Ewing sarcoma. The blood transfusions were very important in my daughter's treatment. When her platelet count would fall off and we would be in danger of bruising, just touching her the wrong way would leave a brown mark. At one point, my daughter had 10% of the minimum amount of what would be considered normal platelets. So we were very prone to bruising and hemorrhaging, and it's a very dangerous situation. But the minute you give a child or anyone who needs platelets a transfusion, the problem is immediately corrected. One thing that was rather scary was realizing that we were completely dependent upon blood donors, and knowing that so often the blood supply is at critically low levels. That was very frightening as a parent, and this happened a couple of times where we would go into the hospital with a dangerously high fever and no hemoglobin and no platelets to speak of. You're basically trying to rebuild your child, and the only way you can do that is going back to the basics of giving them those blood components that they desperately need. And if they're not available, then your child will just suffer. And that is it's a heartache as a parent, and it's tremendously frightening.
They told me that 1 out of every 10 patients who are hospitalized need blood. Lois Speller had a heart transplant. She needed red blood cells, a lot of red blood cells.
I'm AmeriCorps Vista, which is a volunteer in service to America. We work with the senior citizens here at Pilgrim Center. We do dancing, we do table games, we do quite a few different things. The Lord gave me a second chance, so I want to try to help. I want to give back something. And I feel like working with the elderly and all the things that I do, that I'm giving back something to my community and to the world as a whole. I was rushed to emergency because I was having chest pains, and very short-winded. They decided to give me a device called the Jarvik 2000, which is a device that was used to assist me until I could get a transplant. When I actually had my transplant, I had to have blood transfusions. Blood donation saved my life.
When enough blood isn't donated, it becomes even harder for doctors to help save lives. That's one of the reasons blood centers and scientists have worked together to come up with these new systems that can help them get more blood components like red blood cells, plasma, and platelets from the same number of donors. Michael Hebert is donating on the Amicus system, which separates out platelets that are important for cancer patients.
I appreciate the process. The process is rather friendly for donors. It's not painful, and I know there are people that need the donations, so it makes it pretty easy.
The Amicus separator will allow us to collect platelets. And platelets are what our body needs to help clot. If we ever get a little cut on our finger, those are the little things that shoot to that little site there and start clotting. And what that does on that particular machine, it'll take the whole blood and it'll separate the platelets and then return the other products back to you. The ALEX system is a machine which takes whole blood and separates it into red cells. Presently, we are in dire need of red cells because it's the most commonly used and transfused. So this machine will allow us to collect 2 units from one individual. It'll draw the whole blood through the system, separates it into red cells, and then it's going to return the plasma platelets with some saline to make your body feel better.
Does it feel the same as donating the old-fashioned way?
Well, this is the first time I've donated on ALEX, and it was great. This was painless.
But if ALEX and Amicus can help more people, why doesn't everybody donate on them?
Okay, that's a good question. When a donor comes to either a mobile site or a facility, they will be asked a few questions to make sure they're in generally good health and they weigh at least 110 pounds. And from that point, depending on their blood type, sometimes their height and weight, they will either be allowed to do the ALEX system or the Amicus separator.
They say red blood cells are the blood component hospitals need the most, and every year they need about 14 million units.
I thought, well, in the same time that it normally takes me to donate 1 unit of red cells, now I can donate 2 units of red cells, and that's a great opportunity.
By the time my tour is over, my mom is already done. Mom jokes that she donates for the juice and cookies, but I know it's because when I got bone cancer, I needed a lot of red blood cells and platelets. Those donations helped keep me alive. Mom says she always thinks about the people who donated the blood to save me. And when I think of everything she and every other donor has done, I'm glad I am still here to say thank you.